The morning Nora Callum showed up to her third consecutive double shift in mismatched socks and coffee-stained scrubs. Nobody at Crestfield Memorial Hospital in Dunmore, Maine, looked twice at her. That was the point. For 6 weeks she had kept her head down, absorbed the insults, filed the paperwork, and mopped the floors nobody else wanted to touch. She was the nurse people talked over in meetings, the one head nurse Diane Pratt sent on supply runs during codes. Invisible. Forgettable. Exactly what she needed to be. Until the morning 8 black military helicopters cut through the fog over Dunmore Bay, and every one of them was coming for her. If this story already has you hooked, hit subscribe and follow along until the very end. You won't want to miss what happens next. Drop a like and leave a comment telling me what city or country you're watching from. I love seeing how far these stories travel, and it means more than you know. The first thing anyone noticed about Nora Callum, if they noticed her at all, was how quietly she moved through Crestfield Memorial's corridors. Not gracefully, quietly. There was a difference. Grace implied intention, a performance of ease. Nora simply moved like someone who had learned long ago that sound attracted attention, and attention was a liability. She was 37, with short-cropped dark hair she kept pinned back without thinking about it, and eyes the color of old pewter that cataloged every room she entered in the first 4 seconds. Her hands were her most distinctive feature, unusually still for someone in motion, precise without being mechanical. A hospitalist named Dr. James Rutherford had once remarked that her hands looked more like a surgeon's than a nurse's, which was meant as neither a compliment nor an insult, just an observation. Nora had smiled without teeth and said nothing. She'd been at Crestfield 6 weeks. She'd applied on a Tuesday, interviewed on a Thursday, and started the following Monday, which was fast even by the hospital's standards. The hiring manager, a tired man named Gerald who processed paperwork with the energy of someone counting ceiling tiles, had noted that her license was active, her references were clean, and her last employer, a small clinic in rural Vermont, confirmed she'd worked there 18 months without incident. He didn't ask many questions. Crestfield was down 6 nurses on the trauma floor, and the travel agency rates were bleeding the budget. Nora Callum's timing was convenient. That was enough. What Gerald did not look at closely, because he was tired and the coffee machine in the break room had been broken for a week, was the gap in her employment history that stretched back almost 4 years before the Vermont clinic. The paperwork listed it as a personal leave of absence. The reference contact for that period was a number that rang twice and went to a generic voicemail. Gerald had made a note to follow up and then forgotten about it entirely. Nora knew he'd forgotten. She'd counted on it. The trauma floor at Crestfield ran 12-hour shifts that regularly became 14. The charge nurse was Diane Pratt, 51, with close-cropped silver hair and a management style that functioned like erosion. She didn't destroy you in one moment. She just wore you down over time until there was less of you than there used to be. Diane had been at Crestfield for 19 years. She had her people, her rhythms, her hierarchies, and she did not appreciate disruption to any of them. Nora was a disruption from the first shift, not because she caused problems, the opposite. She was too quiet, too precise, and she had a habit of noticing things before other people did. The wrong rate on a drip, the positioning of a post-surgical patient that would cause a pressure injury by morning, the blood pressure reading on a monitor that didn't match the patient's skin color or effect. Each time she flagged something, she was careful to phrase it as a question rather than a correction. I might be reading this wrong, or I'm not sure if this is relevant, but softeners, hedges. She had learned them a long time ago in a different context, but Diane still heard it as correction. And Diane did not like being corrected by someone who had been hired 6 weeks ago and hadn't yet figured out which supply closet had the good tape. Callum. Diane stopped her in the hallway on her second week, coffee in hand, posture engineered to fill as much space as possible. The Ray is patient in 4. You changed the dressing. The original had started to separate at the corner. The protocol says every 48 hours unless there's active seepage. There was moisture under the adhesive. I documented it. I don't care what you documented. You don't override protocol without checking with the attending. Nora absorbed this. Understood. And next time you have a concern about a patient, you bring it to me first, not to the attending directly, not to the resident, to me." "Of course." Diane held her gaze for a beat longer than was necessary, looking for something, pushback, attitude, any indication that Nora was going to be the kind of problem she needed to address more directly. She found nothing. Nora's expression was patient and pleasant and utterly unreadable. Diane walked away. Nora watched her go, waited until the hallway was clear, and then allowed herself exactly 3 seconds of allowing the truth to show on her face, tired, controlled, slightly amused, before smoothing it back into nothing and going to check on her next patient. The man in room 7 was named Donald Ferris, 64, admitted for what had initially presented as a severe respiratory infection. He'd been there 2 days and wasn't improving the way the numbers suggested he should. Nora had read his chart before her shift started, which was not technically required of her, and something about the progression pattern had caught at the edge of her attention. She checked his oxygen saturation, adjusted his positioning, and spent 4 minutes just watching him breathe, not monitoring the equipment, watching him, the way his chest expanded, which side worked harder, the subtle asymmetry in his effort. "You're not getting what you need," she said quietly, not really to him, he was half asleep, but to herself. A thought out loud. She flagged it for Dr. Megan Strauss, the attending on the respiratory floor, in a note that was carefully worded to sound like a question. Noted increased respiratory effort on left side, possible asymmetric presentation, wanted to flag in case a follow-up imaging review might be useful. Dr. Strauss ordered a CT. Mr. Ferris had a developing pleural effusion that the original chest X-ray had missed. The fluid was drained the next morning. By afternoon, he was sitting up eating soup and complaining about the television reception, which Nora took as an excellent sign. Dr. Strauss passed her in the hallway afterward. "Good catch on Ferris." "Thank you," Nora said. "I wasn't certain. I'm glad it was worth looking at." She didn't say I was certain. She didn't say I knew before I read the chart what it probably was. Those things were true, but saying them would have accomplished nothing except attracting attention she didn't need. What she did not know was that Diane Pratt had heard about the Ferris catch from a tech who'd mentioned it in the break room, and that instead of registering as a positive, it had registered as a threat. Bulk. By the 4th week, Nora had been moved to supply inventory 3 shifts in a row. It was Diane's prerogative as charge nurse. Patient ratios, administrative needs. She had reasons. None of them were real. The supply inventory task took 40 minutes. The remaining 10 hours of those shifts Nora spent doing whatever Diane found for her, which was mostly tasks that a first-year nursing student could have completed blindfolded. The senior nurses on the floor noticed. Some of them were uncomfortable with it and stayed quiet, which Nora understood. A few of them seemed to enjoy it, which Nora also understood. And one of them, a nurse named Patty Oswald, 22 years in, gray ponytail, reading glasses perpetually pushed up on her head, brought Nora a cup of coffee one afternoon during a slow hour and sat next to her at the documentation station without saying anything for several minutes. Then Patty said, "You're too good at this job to be this quiet about it." Nora looked up from the screen. "I'm sorry?" "The Ferris thing, the Reyes dressing. Last Tuesday when you caught that Rodriguez kid's medication error before it hit pharmacy. You think I didn't notice? You think the techs didn't notice?" Patty shook her head. "You're good, Callum. Really good. And Diane's been here long enough to know good when she sees it, which is exactly why she's doing what she's doing." Nora considered her words carefully. "I'm still learning the workflow here. I have a lot of catching up to do." Patty looked at her with the particular patience of someone who had been in a place long enough to recognize when they were being managed. "Right," she said, and took a sip of her coffee, and didn't push further. But she remembered. That mattered later. The problem with Dr. Cole arrived in week 5. Except at Crestfield, his name was Dr. Russell Tate, Chief of Trauma Surgery, 48. The kind of doctor who had accumulated enough years and enough positive outcomes to have stopped questioning himself in any meaningful way. He was not a bad doctor. He was a doctor who had mistaken the end of active learning for the achievement of mastery, which was a different thing entirely, and the gap between those two things had quietly widened without anyone holding him accountable for it. Nora had her first real interaction with him over a patient named Gary Ostrowski, 39, brought in by ambulance after a motorcycle accident. Gary had lost consciousness briefly at the scene and regained it before arrival. CT head was negative. 2 cracked ribs, lacerations, road rash across the left arm. Tate looked at the imaging, wrote the orders, and began the process of clearing Gary for discharge with pain management and a follow-up orthopedic referral. Nora was doing Gary's discharge prep vitals when she noticed it. Not a single dramatic indicator. Gary's pressure was fine, his pulse was fine, his oxygen was fine. It was something subtler. The way he held his body when she helped him sit up. The faint tightening around his eyes that didn't match his pain level on paper. The small, involuntary protective positioning of his left side. She looked at the discharge paperwork in her hand and looked at Gary Ostrowski. And something in the back of her mind, not a thought, more like a reflex, said not yet. She went to Tate's station. "Dr. Tate, I'm doing Ostrowski's discharge prep in Base 6. I want to flag something before we release him." Tate looked up from his notes. He had the very specific look of a man who had been interrupted mid-thought by someone he did not expect to say anything of interest. "He's cleared. His vitals are stable, yes, but I'm noticing some guarding on the left side that I don't think is accounted for by the rib fractures. His pain response is a little off. He's rating himself a 4, but his involuntary muscle response is reading higher to me." A pause. "His CT was negative. For the head, yes. I was wondering about serial abdominal assessment, if there's any concern about splenic." "The CT was negative, Callum." He said her name the way people said it when they wanted you to hear that they'd remembered it against their preference. "The imaging is clear, the vitals are stable, and the patient is ready for discharge. Thank you for your attention to detail." "Thank you for your attention to detail" was the clinical equivalent of "sit down." Nora stood very still in the doorway of his station. She had been here before, not here, not this hospital, not this doctor, but this exact pivot point, the moment between compliance and consequence. She was aware that what she did next would define every interaction she had with Dr. Tate going forward. She was also aware that Gary Ostrowski was still sitting in Bay 6 with his body doing something his imaging wasn't showing. "Of course," she said. "Would it be all right if I noted my observations in the chart?" Tate looked at her. "You can note what you want in the chart." "Thank you." She turned to go. "Callum?" She stopped. "Don't make a habit of second-guessing imaging with gut feelings." "Understood," she said, and went back to Bay 6. She documented every observation with the precision of someone who had been trained to document for legal record in conditions where documentation might not be possible for long. She wrote it cleanly, clinically, without editorializing. Then she pulled up Gary's chart one more time and looked at his ambulance report. There was a notation from the paramedic, brief LOC. Mechanism of impact direct left lateral, speed estimated 35 miles per hour. She looked at the mechanism and the positioning and the way his eyes had moved when she'd pressed gently on his abdomen, barely anything, just enough to register. She went to the nurse's station and found the resident covering trauma, a second year named Dr. Ellie Marsh, who was 3 hours into a 24-hour shift and existing primarily on vending machine crackers and an energy drink. "I'm sorry to grab you on Ostrowski in 6, Nora said. "Dr. Tate has cleared him for discharge. I've noted my concerns in the chart. I just want you to be aware, in case his status changes before he gets out." Ellie Marsh looked at her, looked at the chart, read the note. Her eyes moved to Nora's face. "What are you thinking?" "Splenic laceration, low grade, possibly missed on initial imaging. His CT, mechanism, guarding pattern, and the pain response differential. I could be wrong. I hope I'm wrong." Ellie Marsh chewed her cracker. She was 27 years old and still in the phase of her training where she was simultaneously terrified of being wrong and terrified of overriding and attending. But she was also, beneath that, a careful person. She went to Bay 6 and did her own assessment. She came back to the nurse's station and ordered a repeat abdominal ultrasound on Gary Ostrowski. Tate, who was informed, was not pleased. The ultrasound showed a grade 2 splenic laceration. Slow bleed. The kind that became catastrophic when someone went home, took their prescribed ibuprofen, and went to bed. Gary Ostrowski was admitted for observation. He did not go home. He did not have a catastrophic bleed in his apartment in the middle of the night. Tate signed the admission orders and did not come to speak to Nora. Ellie Marsh caught her in the hallway an hour later and said very quietly, "Good catch." And Nora said, "Thank you for listening," and meant it, because the truth was that without Ellie ordering the ultrasound, the catch meant nothing. What happened next was predictable and not predictable at once. Diane Pratt heard about the Ostrowski intervention from somewhere. Hospitals were the worst possible environment for information privacy, and called Nora into her office the following morning. The office was small, with a window overlooking the hospital's east parking structure. Diane sat behind her desk with the posture of someone who had rehearsed this. "I heard about what happened with the Ostrowski discharge. I documented all my observations in the chart. You went around Dr. Tate to a resident. I flagged my concerns to the covering resident after documenting, yes." Diane's expression was controlled, but not neutral. "That's not how this floor works, Callum. There is a chain of communication, and when you bypass it, you undermine the authority of the physicians you work with. My intent was to advocate for the patient. Your intent is not the issue. The issue is your approach. Dr. Tate cleared that patient based on imaging and clinical judgment. You second-guessed that judgment using nothing but a feeling. I used documented physical assessment findings. You used a feeling." Diane folded her hands on the desk. "I've been watching you since you started here. You're technically capable, but you have a problem with operating inside a system, and that problem is going to get someone hurt." Nora heard the inversion in this, that in Diane's framing, advocating for a patient against incorrect clearance was the danger, not the incorrect clearance itself. It was a specific kind of institutional logic, and she had encountered it before, and she understood its mechanics completely. That understanding didn't make it easier to sit across from. "I'll take that feedback," Nora said. "I'm also adjusting your assignment for the next 2 weeks. You'll be on support rotation. I need someone reliable covering administrative triage and supply coordination." It was not a question. Nora looked at the parking structure through the window and thought, without drama, that she had been buried in worse places. "Of course," she said. "Is there anything else?" Diane seemed faintly dissatisfied, as if she had been looking for a reaction and hadn't found the right one. "That's all." Nora stood and left and went to her first shift on supply coordination, which involved counting inventory items in a closet for 4 hours. She counted accurately. She noted 2 discrepancies in the ordering records that saved the department approximately $800. She did not tell anyone about the discrepancies. She just filed the correction and went home. The following morning, she drove to the waterfront before her shift and sat with a cup of bad coffee and looked at the bay. Dunmore was a small city, 70,000 people, a fishing heritage it was leaning hard into for tourism, a hospital that served the coastal region and had exactly as many resources as coastal hospitals at its size always did. She had chosen it for its proximity to the water and its distance from everywhere she'd been. She had not chosen it to stay forever. She knew that about herself. But the morning was cold and clean, the fog sitting low on the water, and she allowed herself 15 minutes of not thinking about the hospital or Diane Pratt or what the next 2 weeks of supply closets were going to feel like. She just watched the water move. Her phone buzzed, a text from an unknown number, which was the only kind of text she ever received from certain people, that contained a single line: "Situation developing. Stay close." She read it twice, deleted it, finished her coffee, stayed close. Amant. The 6th week brought a maintenance worker named Hugh Daly into the ER at 6:40 in the morning with his arm caught on the receiving end of a poorly timed decision involving a commercial elevator door. His forearm was badly lacerated, deep enough to raise concerns about tendon involvement, and he was in significant pain and trying to minimize it, in the way that men of a certain generation often did, which mostly meant he was very white in the face and making jokes at a low volume. Nora was the first nurse to reach him. She got him stabilized, ran a quick assessment, started managing the bleeding with the efficiency of someone doing something they had done many times. Hugh watched her work. "You're fast," he said. "Try to be." "That's a bad cut, right? I've got a bad feeling about this." "You've got a deep cut." "Different thing." Where were you when this happened? Sub-basement. The old elevator in the East Wing. Things been dropping millimeters out of alignment for 3 months. I put in 5 work orders. That's frustrating. 422 pounds of elevator doors, frustrating, he said, and winced as she applied pressure. Sorry, that was... You're fine. Breathe out. He breathed. You been here long? 6 weeks. I've been here 11 years, seen a lot of nurses come through. You're different. Nora glanced up. Different how? Hugh thought about it with the honest slowness of a man who was managing pain and trying to be accurate at the same time. Like you're watching something none of the rest of us can see. She said nothing and secured the pressure dressing and went to find the ER attending. Behind her, Hugh Daly looked at his wrapped arm and then at the doorway she'd disappeared through and thought he would not be able to articulate why. That whatever was different about that nurse, it wasn't small. The attending who assessed Hugh was a physician named Dr. Barney Walsh, whose domain was the emergency department and whose relationship with the trauma floor nurses was cool without being hostile. He examined Hugh's arm, agreed about tendon concern, ordered imaging and a plastic surgery consult. Good, routine, appropriate management. Then he turned to Nora, who was still in the bay completing documentation. Callum, right? Diane's floor. Yes, sir. What are you doing down here? Short-staffed this morning. They sent me to cover intake for a few hours. Walsh looked at her assessment notes. A pause. This documentation is very thorough. Thank you. Another pause, the kind that meant someone was doing quiet arithmetic. You have a surgical background? It was a question that required a careful answer, not a lie. She didn't lie, as a principle, because lies required tracking, and she had more important things to track. But an answer that was accurate and incomplete. I've worked in different clinical environments, she said. Picked up some habits. Walsh nodded slowly and let it go. But she saw the mental note get made, and she logged it, and she understood that time was beginning to behave differently in this particular chapter of her life at Crestfield Memorial. She was right about that. She just didn't know yet what it was moving toward. The call came in at 11:42 on a Tuesday morning in the form of an emergency broadcast that cut across the hospital's overhead comm system with a sound Nora had last heard in a very different kind of building. Crestfield Memorial, this is a regional mass casualty notification. All available trauma staff report to emergency department staging. This is not a drill. The explosion at the Harwick Defense Research Facility, 12 miles east of Dunmore on the coastal highway, had happened at 11:26. 16 minutes earlier, some kind of catastrophic event had turned a classified facility into a disaster site of the kind that hospitals were trained for and never entirely ready for. The initial reports coming through the trauma department's emergency channels were incomplete and contradictory. Explosion, possible secondary event, unknown number of casualties, unknown nature of materials involved. What was known as the trauma floor erupted into controlled and less controlled motion around her. This was coming to them. The nearest Level 1 trauma center was Harwick General, 2 miles from the facility. And Harwick General was, according to the secondary broadcast that came through 40 seconds after the first, compromised. Power outage. Unknown cause. Not receiving. Everything was coming to Crestfield. Nora was in the hallway when the notifications hit, and she stopped. And for exactly 3 seconds, she stood very still while everyone else around her began to move. 3 seconds of stillness in which something in her posture changed. Not visibly, not dramatically, just a millimeter of difference in how her shoulders sat and how her chin leveled and where her eyes went. She looked at the ceiling. She looked at the corridor layout, the distance to the trauma bays, the position of the crash carts, the number of people she could see, and the direction they were moving. She counted. Then she moved. She was not supposed to be in the trauma department. She was on supply rotation. Diane's punishment, technically covering administrative triage intake for the ER. What she did instead was go straight to the trauma team staging area where the charge ER physician, a doctor named Wendy Farrow, was trying to do 6 things simultaneously and not entirely succeeding at any of them. Dr. Farrow, Nora's voice was level. What's your current bay capacity? Farrow looked up with the expression of someone who hadn't expected a useful question. 12 active bays, maybe 3 with minor prep remaining. Overflow? We can convert the procedure rooms. That gives us 4 more. Supply status on blood products? Farrow blinked. I'd have to check with... I can check. Give me 2 minutes and a radio. Nora was already moving. You need your overflow corridors cleared and staged before the first vehicle arrives. The procedure room conversion should start now, not when the first wave hits. If Harwick was the primary receiver and they're down, you're going to get more than your clean capacity. Who are you? Farrow said, not hostile, genuinely, practically asking. Trauma floor, Nora Callum. A beat. I've worked mass casualty events before. Farrow made a decision in approximately 1 second, which was the speed at which good emergency physicians made decisions when the information was sufficient. Blood products, procedure room prep, corridor staging, go. Nora went. She was running the third supply check and coordinating the procedure room conversion with a team of 2 techs and a respiratory therapist when Diane Pratt found her. Diane had come down from the trauma floor when the notification hit, and she had been managing her own staff mobilization. And then she had turned a corner and found Nora Callum with a radio giving instructions to people who were following them. Callum, the word landed like a flat object. What are you doing? Nora didn't stop moving. Supply inventory for blood and plasma, procedure room conversion to overflow bays. We've got approximately 6 to 10 minutes before first arrival based on transport time from Harwick. You are on administrative rotation. There are people coming in with blast injuries and we don't have enough active bays. Nora stopped and turned and looked at Diane with an expression that was entirely calm and entirely finished with a certain kind of conversation. You can send me back upstairs after this. Right now I need to finish what I started. Diane's face went through several things at once. Authority, outrage, and beneath those, pressed down but not invisible, the thing that people with good instincts felt when they were standing next to someone operating at a level they hadn't previously clocked. Not admiration. Not yet. Just recalibration. Report to Dr. Farrow, Diane said finally, and you answer to me when this is over. Understood. Nora turned back to the supply cart. The first ambulances arrived at 11:53. 7 minutes after that, the sound changed in the way that Nora had heard it change before and hoped she would not hear again. The deep, rhythmic percussion of helicopter rotors, not 1 or 2, cutting through the late November coastal air above Dunmore, Maine. She was in Trauma Bay 4, working alongside a resident named Marco and a tech named Sylvie on their second incoming patient when she heard it. Her hands did not stop what they were doing, but her head came up and she counted beats, and her eyes moved to the windows of the trauma department that looked out over the east side of the building. 8. She counted 8 distinct rotor signatures before she placed the count. Her throat tightened, a reflex she didn't show. 8 was not a coincidence. 8 was not a regional military response to a civilian mass casualty event. 8 was something else entirely. She finished the port placement she was working on, taped it clean, handed off to Sylvie. You've got this. She walked toward the ambulance bay entrance, moving against the flow of people coming in. And when she got to the exterior doors and looked out at the sky above Crestfield Memorial Hospital, she saw them dropping through the coastal fog in formation, black, unmarked, descending with the precise intent of something that had been planned, and she understood in a way that settled cold through her chest that the thing she had been running from for 4 years had just arrived in Dunmore, Maine. It had arrived in 8 helicopters, and it was coming for her. She stood in the ambulance bay doorway for exactly 4 seconds. That was how long it took her to run the calculation. Not the emotional one. She pushed that down to somewhere it couldn't interfere, but the tactical one. 8 helicopters with military signatures descending on a civilian hospital during an active mass casualty event. The Harwick facility. The text she'd deleted that morning, the timeline. 4 seconds. Then she turned around and walked back inside, because there were patients arriving and standing in the cold, staring at the sky, accomplished nothing, and whatever was coming could wait the length of time it took her to finish what she'd started. The trauma department was operating at the edge of its capacity in the way that emergency departments did when volume outpaced preparation. Not collapsed, not yet, but fraying at the seams in places where the seams were already thin. The first wave from Harwick had delivered 11 patients in 22 minutes. Blast injuries, burns, crush trauma, and one cardiac arrest that the paramedics had been working since the vehicle. The cardiac arrest died on the bay table, while 3 people who could have saved him were managing 3 other patients simultaneously, and that was simply how it was. And the people who had been there long enough knew to file that grief somewhere. It could be processed later and keep their hands moving. Nora kept her hands moving. She was working with the controlled aggression of someone who had made a choice to stop holding back, which was different from losing control. Every movement had a reason. Every decision had a hierarchy. She was 3 steps ahead of what was visible in the bay, which meant she looked unhurried even when the room was loud and wrong, and that quality, the stillness under pressure, was beginning to make the people around her very uneasy in a way they couldn't articulate yet. Marco, the resident, noticed it first. They were managing a 30-year-old male with a blast injury to the lower extremities. Both legs, significant soft tissue damage, blood loss that the man's blood pressure was beginning to truthfully report. Marco was competent and frightened in equal measure, which was an honest place for a second year to be in this situation. "He's dropping," Marco said. The pressure on the monitor had slipped another 6 points. 2 large-bore IVs, left AC and right EJ, run the fluid wide open and get blood on the way. Nora was already moving to the right position without being told, positioning herself for the external jugular if Marco needed backup. "What's your index of suspicion for arterial involvement?" "The right femoral looks." He stopped, recalibrated, spoke more precisely. "Possible partial transection. I can't get clear visualization with this much active bleeding." "Okay, tell me what you need." He looked at her. He was used to nurses who told him what they needed. The reversal of it took him a half-second to process. "Pressure packing, then we need vascular. Can we get vascular down here?" "I'll get vascular. You pack." She handed him the supplies before he finished the sentence. She hit the comm for the vascular attending while applying simultaneous pressure to the lateral bleed Marco hadn't noticed yet, which was seeping through the dressing on the left leg, secondary to the arterial concern, but meaningful in terms of total blood loss. She communicated with the vascular team using the kind of language that got people moving, not panicked, but with no space for delay, and then returned her attention to the bay. "He's going to hold," she told Marco, though she was not certain of this. What she was certain of was that Marco needed to hear it in order to stay focused, and that the man on the table needed them both focused. "Do not let that pressure dressing shift. Keep him talking if he's conscious." "He's in and out." "Then talk to him anyway." It was in this moment that Diane Pratt appeared at the bay entrance. She had been navigating the floor in her charge capacity, managing staff placement, and she had come to check on Marco's bay because Marco was the least experienced attending level on the floor, and this patient looked like the most serious they had. She arrived expecting to find a nurse supporting a resident. What she found was a nurse directing one. Not visibly, not loudly. If you were watching without understanding clinical dynamics, it might have looked like collaboration. But Diane had been a nurse for 29 years, and she understood clinical dynamics, and what she was watching was not collaboration. Nora Callum was operating at a level above what her position, her credentials on file, and 6 weeks at Crestfield Memorial explained. She was operating at a level that did not make sense unless you accepted that something in her background was not what it appeared to be. Diane watched for 40 seconds without announcing herself. Then she stepped back from the doorway and let Nora work. She did not interrupt. Later, she would not be sure whether that was good judgment or paralysis, and she would not be able to separate the two. The helicopters landed on the east side of the building, which had a helipad rated for 2 simultaneous aircraft, and then on the east parking structure roof, which was not officially rated for this and had never been used for it, and then in the parking lot itself in the spaces between ambulances, which was not rated for anything but happened anyway because the pilots were landing in the places that existed, and that was the end of it. The staff who were near windows watched this happen with a collective silence that had a quality of unreality to it. 8 military helicopters in a hospital parking lot in Dunmore, Maine. People in dark tactical gear moving with the coordinated efficiency of a unit in an operational environment, stretchers, equipment cases, weapons, visible weapons on people entering a hospital, which was not something the staff had frameworks for. Dr. Wendy Farrow, managing the department from the central station, looked at the east parking lot camera feed on her screen and said, "Someone get me a contact on who those people are and why they're here." Nobody had an immediate answer. The first of the tactical personnel came through the trauma department's secured ambulance entrance 3 minutes after landing. 4 of them carrying a stretcher, 2 more flanking, and behind them a man in a field uniform with insignia that 2 of the nurses present would later describe as military, but couldn't precisely identify in the moment. He was looking for someone. That was clear before he opened his mouth. He stopped at the nursing station and said without preamble to the first person he made eye contact with, a unit coordinator named Leslie, "I need Voss." Leslie blinked. "I'm sorry?" "Elena Voss. I need her now. We don't have a..." "That's not a name I have on our staff list." The man looked at her for a beat, then past her, scanning the department with the systematic efficiency of someone trained to locate specific things in chaotic environments. "She's here," he said, not to Leslie anymore, almost to himself. "Brown, check the active bays." One of the personnel flanking him moved into the trauma department, and the staff who saw it happen would describe it differently depending on where they were standing. Some said it was frightening, some said it was surreal. One tech named Rob said it looked like a movie and immediately recognized how inadequate that description was. Nora heard the name from 15 feet away. She was between bays, moving from Marco's patient toward the next intake, and the name came through the ambient noise of the department, the way certain sounds come through noise when your nervous system has been trained to catch them. Not loud, not directed at her, but landing exactly. She stopped. She stood with her back to the nursing station for 2 full seconds. Then she turned around. The man who had asked for Voss was perhaps 50, with the flat, compressed quality of someone who had spent a long time in high-stress environments and had reorganized himself around them. He had a scar along the left side of his jaw and close-cropped gray hair and the expression of someone running an operation in conditions that were already departing from plan. His name was Harlan Briggs. She had not seen him in 4 years. He found her across the department the same moment she turned. There was a pause between them that lasted less time than it felt, half a second, maybe. And then he crossed to her with the direct efficiency of someone who did not have time for preamble. "We need you," he said. "I'm busy," she said. "Voss? Callum." She said it quietly and precisely. "Here. I'm Callum. And I said I'm busy." She turned toward the next bay. He stepped into her path, not blocking her. He knew better than that, but placing himself where she had to acknowledge him. "We have 7 critical coming in off the helicopters. 3 of them you need to see personally. 1 of them is going to die in the next 2 hours without intervention that your ER attending is not equipped to provide." She looked at him. "Then he needs a better equipped facility. The weather window that brought us here is closing. We can't fly him out. Voss." He said it again, not loudly, but with the weight of history behind it. "We're here. You're here. The pretending is done." Something moved behind her eyes. Not grief and not anger exactly. Something older than either. Something that had been sitting in her chest for 4 years without a name. "Give me 4 minutes to hand off my current patients," she said. "Don't tell anyone else anything until I've spoken to Farrow. And stop using that name." He held her gaze. 4 minutes. She handed off in 3. The conversation with Wendy Farrow happened in the corridor outside the central station, fast and without softening, because there was no time for softening and Nora had never been good at it anyway. "The personnel who came in off the helicopters? I know them," Nora said. Farrow stared at her. "You know them. From a previous professional context. They have critical casualties that overlap with my training and experience in ways that are going to matter in the next hour." "What training and experience?" Farrow's voice was level, but her eyes were doing the work of several different emotions simultaneously. "I need you to trust that it's relevant without me explaining it in a hallway right now." "That's not how hospitals work, Callum." "I know, I'm asking anyway." Farrow looked at her for a moment that felt longer than it was. She was a good emergency physician, which meant she made decisions on incomplete information regularly, and she was good at reading the quality of sources. She was reading Nora now and finding something she couldn't put in a box. "What do you need?" Pharaoh said finally. "Bay Access, your most capable team, and Dr. Tate." A pause. "Russell Tate." "Yes." "He's going to hate this." "I know." "Okay." Pharaoh said it like a period, not a question. "You've got Bay 7, 8, and 9. Tate is on the floor. I'll pull him." "And Callum?" She stopped her. "We're going to have a very long conversation when this is done." "I know that too." She found Harlan in the staging area off the ambulance bay where 3 of his personnel were managing the earliest arriving critical patients with equipment from their own kits, which told her the situation had been bad enough before they landed that they'd started intervention in the field. She looked at the patients in order, fast, comprehensive, the way she would have looked at them in a different life with different tools in different places. The first 2 she could manage with existing trauma resources and clear instruction. The third was a man she didn't recognize, mid-40s, blast trauma to the chest with a complicating factor that she saw the moment she peeled back the field dressing. A shrapnel fragment, substantial, embedded in the right chest wall in a position that was millimeters from catastrophic, and had been sitting there long enough for the surrounding tissue to begin a response. She straightened and looked at Harlan. "How long?" 40 minutes since injury, 20 since extraction." "You didn't tell me about the fragment." "I'm telling you now." She held his gaze for a moment. "Where's the equipment?" "Third case. We've got what you'd need for a field thoracotomy. More than field, actually. We had a surgical team on standby before the secondary event changed the plan." "What happened to the surgical team?" A pause that contained more information than a full sentence. "Secondary event," he said again. She understood. She looked back at the patient and made the calculation she needed to make, which was not simple and was not comfortable but arrived quickly because it was the kind of calculation she had made before, and her mind moved to the answer the way water moved to the lowest point. "I need Tate," she said, "and I need him now, not in 5 minutes." "That surgeon? The one who—" "He's what we have. He's adequate." She paused. "I'll guide him through the parts he doesn't know." Harlan looked at her with something that might have been, in better circumstances, dark amusement. "You're going to guide the senior trauma surgeon through his own procedure." "I'm going to give him information that allows him to complete a procedure he's technically capable of. There's a difference." She turned. "Get him." Russell Tate arrived in Bay 9 3 minutes later, and the expression on his face when he saw who was waiting for him was a specific kind of confusion that came from having a context shatter. He had come because Pharaoh had asked him with a tone of voice that didn't leave room for negotiation. He had not expected to find Nora Callum standing next to a tactical patient with military personnel arrayed around the bay like they'd been there for years. "Callum." He said her name the way he'd said it before. Her name as a question, her name as a category error. "What's going on?" "There's a chest fragment, right thoracic. Position is close to the pulmonary artery." She showed him the imaging that Harlan's team had taken in the field with their portable unit. "The approach needs to be lateral, not anterior. If you go anterior with standard positioning on this, you will hit the fragment before you have visualization." Tate looked at the image. She watched his face go through the professional processing, bypassing whatever personal reaction he was having for the immediate clinical reality, and she gave him credit for that. It was not nothing. "You got this from their field imaging?" he said. "Yes, it's sufficient quality for our purposes." "The lateral approach? That's not standard for this presentation." "No, but it's correct for this specific anatomy and this specific fragment position." She held the image toward him. "I can walk you through the landmarks." He looked at the image. He looked at the patient. He looked at her. "You've done this before," he said. It was not quite a question. "Multiple times," she said, "in conditions considerably worse than this bay." The silence between them was short and had several things inside it. "Okay," Tate said. "Walk me through it." The procedure took 51 minutes. Nora stood at Tate's left shoulder and spoke in a low, continuous stream of guidance that was not instruction, not exactly, but information, landmark by landmark, the kind of information that a surgeon needed when operating in territory adjacent to their training. Tate was skilled. She had not been lying when she said he was adequate. His hands were good. His judgment in the moments where she paused was often correct. And when she said stop or left 2 millimeters, he stopped and moved left without asking why, which was the quality she'd needed from him and had not been certain she'd get. The fragment came out at minute 38. The margin between where it had been sitting and the pulmonary artery was 4 millimeters. Nobody in the bay said anything for a count of 3 when it cleared. Then the anesthesiologist said something under his breath that might have been relief rendered as profanity, and the scrub tech exhaled, and Tate continued closing with hands that were very slightly less steady than they'd been at the start. When it was done, Tate stepped back from the table and looked at his hands for a moment, the way surgeons sometimes did when the work was finished and the adrenaline had no more specific task and needed somewhere to go. Then he looked at Nora. He didn't say anything. She didn't need him to. Outside the bay, Harlan was waiting. He'd been updated by one of his personnel during the procedure, and his posture told her the outcome before she confirmed it. Around them, the hospital continued doing what hospitals did: patients, noise, movement, the endless managed chaos of a mass casualty event working through its phases. "He's stable," Nora said. Harlan nodded. "2 more in Bay 8. Pharaoh's team has them, but I'll go now." She stripped her gloves, then she stopped. "Harlan, the facility. What actually happened?" He looked at her with the expression she knew from previous contexts, the calculation of what to say and what to hold. "Not here." Short version. A pause. "It wasn't an accident." She absorbed that. "The secondary event that took out your surgical team. Also not an accident." She kept her face neutral. "Okay. There's more, Voss. There's a lot more. We need to talk once." "Callum," she said again, automatic. And then she heard the sound from down the corridor. Not the sound of the department. She was filtering that, processing it as background. This was a different sound, cutting through. A change in the quality of noise from the direction of the ambulance bay, where Harlan's last helicopter had offloaded a final critical transport 40 minutes ago. She looked toward it and saw 2 of Harlan's personnel moving fast toward Bay 9. Not fast like urgency, fast like response. The different kind of fast that meant something had changed in a patient whose stability had been assumed. Behind them, slower, was a man she had not seen come in. Civilian clothes but military posture, with the particular expression of someone who had authority in a context that no longer applied and was in the early stages of understanding this. He was looking at the department with the inventory gaze of someone assessing a situation for leverage, and when his eyes moved to Nora, they stayed there with a recognition that had nothing hospitable in it. She did not know his face, but she knew the type, and the type did not arrive during a mass casualty event to help. "Who's that?" she said quietly to Harlan. Harlan's jaw tightened in a way she had not seen from him in 4 years. "His name is Garrison Felt. He's a federal oversight director for the Harwick Project." A pause. "He should not be here." "Why is he here?" "Because someone called him when our helicopters landed." She looked at Felt. Felt looked at her. Across the controlled disorder of the trauma department, something moved between them that was not introduction and not greeting, and was entirely the acknowledgement of a problem neither of them had finished defining yet. Then one of Harlan's personnel appeared in Bay 9's doorway and called out in a voice that was professionally controlled and urgently clear. "Voss, we need you in here. Now." The name rang out across the department floor the way names did when people forgot to calibrate their volume under pressure. Too loud, too clear, carrying past the bay and into the corridor and to the nurse's station and to the ears of Diane Pratt, who had been managing her floor with sustained composure since the crisis began and who now stood very still near the central station with her head up, staring toward Bay 9, having just heard the personnel call out a name that was not Callum. Having heard a name that didn't belong to a trauma nurse from a small clinic in Vermont. Having heard a name that belonged to someone else entirely. Someone with a history and a rank and a reason to disappear. An understanding in the way that people understood things they didn't want to understand, that the woman she had been moving to supply closets and administrative rotation for 6 weeks was not who she had filed paperwork for. And the man in civilian clothes, Garrison Felt, heard it too. He was already moving toward Bay 9, and his hand was reaching for the phone in his jacket pocket, and the expression on his face was not the expression of someone who had arrived to help. Nora moved before Felt reached the bay. Not running. She didn't run, because running in a trauma department meant something was catastrophically wrong, and she didn't need 12 people losing focus on their current patients, but moving with the compressed urgency of someone for whom fast and visible were different calculations. She covered the distance to Bay 9 in 7 seconds, pushed through the doorway, and took in the room in the way she always took in rooms: total, immediate, hierarchical, by threat level. The patient on the table was a man she hadn't treated yet. He'd come in on the last helicopter, cataloged as stable critical, which meant he'd been triaged behind the fragment case and the 2 in Bay 8. She hadn't gotten to him. Looking at him now, she understood that stable had been optimistic. His name, one of Harlan's personnel told her, was Sergeant First Class Devlin Rourke. 34. He'd been 15 meters from the secondary detonation at Harwick, and the blast wave had done what blast waves did to human bodies that were close enough. Not the visible drama of fragmentation, but the internal hydraulic injury that didn't always declare itself immediately and then declared itself all at once. Right now, it was declaring itself. His pressure had dropped 12 points in 6 minutes. His oxygen saturation was sliding. The resident covering the bay, a young woman named Dr. Paula Shen, had caught the trend and was managing it with the competence of someone who knew they were at the edge of their training and wasn't pretending otherwise. Tension pneumo? Nora asked, moving to the patient's right side. I don't think so. Breath sounds are equal, but his trachea is... Paula stopped, recalibrated. Slightly deviated. Right. Nora put her hand on Rourke's chest and pressed lightly, reading the tissue response. She looked at the monitor. She looked at his neck veins, which were distended in a way that told her something specific about what was happening on the other side of his sternum. This is cardiac tamponade, she said. Not a question. Paula absorbed it. The field ultrasound. Wasn't sensitive enough for an early effusion with this much competing injury. Get me a bedside echo now, and I need a pericardiocentesis tray. Paula was already moving to the comm. Nora looked at Rourke's face. He was conscious, marginally, watching her with the particular focus of someone whose body was failing and who had locked onto the nearest person who seemed to know what was happening. Hey, she put her hand briefly on his forearm. You're in a hospital. We're working on it. He blinked. His lips moved. She leaned closer. Voss, he said. His voice was air and nothing else. She didn't correct him this time. Don't talk. Just breathe. The bedside echo arrived in the hands of the ultrasound tech, a man named Gary who had been awake for 11 hours and was running on the specific alertness that crises produced. Nora took the probe and placed it herself, angling for the subxiphoid view, and there it was on the screen, the characteristic shimmer of fluid around the pericardium, the right ventricle beginning to collapse inward under the pressure. Not huge. Didn't need to be huge to kill him. Confirmed, she said, and handed the probe back to Gary. Tray. Paula had the tray ready. Nora looked at it, looked at the room, and made a decision that she made for 2 reasons. Tate was coming off the fragment case and needed recovery time, and she was faster. That was all. Not a demonstration, not a statement, just arithmetic. She did the pericardiocentesis with Paula managing the echo guidance and Gary on the monitor, and one of Harlan's personnel standing at the door with the particular stillness of someone who had seen field procedures and was not going to be the person in the room who flinched. The needle went in at the correct angle, the correct depth, and the fluid that came back into the syringe was the dark, non-pulsatile blood that confirmed what the echo had shown. 45 milliliters. Rourke's blood pressure began climbing before she finished the aspiration. She watched the monitor, watched his face, saw the specific change that happened when a heart was no longer fighting against pressure it couldn't overcome. Not dramatic, just a loosening, a small restoration of something that had been on the verge of permanent absence. Good, she said, to no one in particular. To the situation. To the math that had worked out this time. She was withdrawing the needle when Garrison Felt walked into the bay. He did not knock. Hospital bays didn't have doors that knocked, but there was a version of pausing at the threshold that people did when they understood they were entering a clinical space in the middle of a procedure. Felt did not do it. He walked in with the authority of someone who had decided the authority of the room belonged to him, and he looked at Nora with the expression she'd clocked from across the department, recognition and something underneath it that was operational, calculating. "Step away from the patient," he said. Nobody moved for a moment. Not because nobody heard him, he was loud enough, but because the instruction was so clinically irrational that the brain needed a full second to process it as something real that a person had actually said in a functioning emergency department. Paula looked at Felt, looked at Nora. I'm aware of what she did. Step back from the patient, all of you. I need this bay cleared of non-authorized personnel." Nora set down the syringe with the precise care of someone completing a procedure correctly and then turned to face Felt. She was still wearing gloves. There was blood on the left cuff. "This patient is hemodynamically unstable post-procedure. Clearing the bay right now would put him at significant risk. I'm not asking about his stability. I'm asking about your authorization. I'm a licensed registered nurse at this facility, and I just performed an emergency procedure under exigent circumstances. That's the authorization." Felt took one step closer. He was perhaps 55, with the groomed containment of someone who had spent decades managing information, and he had the specific quality of confidence that came not from competence but from institutional power, the confidence of someone who had never been in a room where his title didn't work. "You are Elena Voss," he said, "former Commander, Unit 17 Classified Research Operations. You separated from that program under terms that explicitly prohibit unauthorized medical intervention in situations involving program personnel." The bay went very quiet. Paula was staring at Nora. Gary was staring at Nora. The tactical personnel in the doorway had gone from still to a different kind of still. Nora kept her eyes on Felt. "This man's life is a classified matter under federal jurisdiction, and you are not authorized to be involved with it." He reached into his jacket and produced a credentials case, which he opened and held toward her with the practiced motion of someone who had used it as a conversation stopper many times. "I'm directing you to step back, and I'm directing the medical staff in this room to hand off his care to the personnel I'm bringing in." "What personnel?" Paula said. She sounded admirably more confused than frightened. "You came in on those helicopters? Do you have a medical team?" "That's not your concern." "It is absolutely my concern. I'm the covering physician in this bay." Felt looked at Paula with the particular dismissal of someone who had decided she was an obstacle rather than a person. "Doctor, I'd recommend you consider your position very carefully before he will die." Nora said it without volume, without drama, with the flat authority of someone reporting a fact. "If you clear this bay and hand him to personnel who weren't managing the effusion during the procedure, he will die. The fluid will reaccumulate. This was not a definitive intervention. It's a temporizing measure. He needs monitoring. He potentially needs a surgical window, and the people who understand his current status are in this room." Felt looked at her. A pause that meant he heard her and was filing it in the category of things that were inconvenient to his agenda rather than things that changed it. "Step back, Commander." She didn't step back. Harlan Briggs appeared in the bay doorway behind Felt. He took in the room, fast, the same way Nora took in rooms, and his face did something complicated that resolved into professional neutral. "Garrison," he said. Felt turned. "Colonel, I need this bay." "I heard you." Harlan moved into the room and positioned himself in the space between Felt and the patient with the economy of someone who had thought about where to stand before he stood there. "Rourke is our asset and our responsibility. Any intervention on his status goes through me. The terms of the program clearance are not your primary concern in this building right now." Harlan's voice was level and had iron under the level. "You're a program director, Garrison, not a physician, not a field commander. And right now you're standing in the middle of an active emergency department that is managing 17 critical patients, threatening a nurse who just kept one of my men alive, and you are doing it with no medical authority and a credentials case." A beat. "Stand down." The room held its breath. Felt's jaw moved. His options were visible in the calculation that crossed his face. Escalate, retreat, find a middle position. He was not a man who retreated, so he found the middle. "This conversation continues outside the clinical area," he said, "and it continues at a level above both of you." He looked at Nora with the look of someone making a record for later. "You're not done here, Commander." He left. The sound of the department flooded back in like pressure equalizing. Paula exhaled through her nose. "Who was that?" "Someone who's going to be a problem," Nora said. She stripped her gloves. "Monitor Rourke closely. I want pressures every 3 minutes for the next 20. If the saturation drops again or you see any JVD returning, page me immediately." "Where are you going?" "To stop him from becoming a bigger problem." She looked at Harlan, who was still standing in the center of the bay with the expression of a man who had used up one solution and was calculating the next. "How much of what he said is true? The prohibition clause." "There's a clause," Harlan said. "Whether it applies to what you just did in a civilian hospital during an active mass casualty event is a legal question that I would argue takes approximately 30 seconds to resolve in your favor." And Felt doesn't care about the 30 seconds. Felt cares about what happened at Harwick before the explosion. The prohibition is a tool. He paused. "Voss, tell me what happened before the explosion." He looked at Rourke, looked at the door, made the decision. The secondary device was internal. Someone inside the facility set it off. The people it was designed to eliminate were the oversight personnel who documented the safety failures in the primary program, the ones who were about to go external with the documentation. She stood very still. Someone killed the whistleblowers. Killed 2 of them. The documentation survived, partially. He met her eyes. Felt's name is in the documentation. The weight of it landed. Not surprise. She had stopped being surprised by the specific ways that institutional self-protection expressed itself, but something that settled into her sternum with the density of confirmed suspicion. He came here to manage it. He came here to see who survived and what they might say, and then he found you. Harlan's voice was carefully even. "You're a variable he didn't plan for." "I'm not a variable," she said. "I'm a nurse at a civilian hospital who is going to go check on her other patients." She moved for the door. "Elena." He used her name, her actual name, and she stopped. He almost never used it. "He's already made a call. I don't know to who yet." She thought about that for 2 seconds. "Then we have less time than I'd like." She went out into the department. The department was moving through the mid-phase of the mass casualty event. The initial wave of chaos had organized itself into sustained high-volume management, which was different in character if not in intensity. Staff had found their rhythms. The most critical patients had been triaged and distributed. The noise had changed from reactive to procedural. Nora moved through it with the awareness of someone tracking 2 separate operational layers simultaneously. The clinical one, which was her job, and the other one which had arrived on 8 helicopters and was getting more complicated by the minute. She stopped at the nursing station where Patty Oswald was managing documentation with the steady efficiency she brought to everything. Patty looked up at her and said nothing for a moment. "You want to tell me something," Patty said finally. "I want to tell you that if anyone comes to this station asking about my personnel file or my licensing documentation, you tell them to go through hospital administration and you call Pharaoh." Patty held her gaze. "Okay. And if a man named Felt, civilian, 50s, dark jacket, tries to access any clinical areas, he is not authorized, and you can tell him that." "On what basis?" "On the basis that he has no clinical credentials and no hospital affiliation." A pause. "What's going on, Callum?" "A lot," Nora said. "I'm sorry I can't be more specific right now." Patty looked at her for a moment with the eyes of someone who had seen 22 years of things and had gotten good at identifying which category they fell into. "Are you in trouble?" Nora considered the honest answer. Some version of it. Patty nodded slowly, like someone confirming something they'd suspected for a while. "Go do your job," she said. "I've got the station." The man in Bay 12 had been there since the second wave. Blast injury, right arm, burns across the shoulder and neck that were serious but survivable with appropriate management. He was conscious and had been for the past 40 minutes, which meant he'd had 40 minutes to lie on a bay table and understand that his situation was bad without anyone with sufficient information to address the understanding. His name was Kowalski. She'd read the intake tag. He was perhaps 30, with the particular build of someone who worked physically and had the injuries to show for it accumulated over years. He watched her come in with the eyes of someone who had been waiting for exactly this. "You're the one they were calling for," he said. His voice was rough, but even. She checked his burn dressings first, then his arm. "How's your pain level?" "Manageable." "What's happening outside?" "We're managing a mass casualty event." "I know that. I was there." He moved his left hand slightly, the unbandaged one indicating the general direction of outside with a gesture that communicated more than it showed. "Harwick. I was in the secondary corridor when it went, saw the device." She stopped, looked at him. "You saw it." "Wasn't there by accident. Someone put it there. I know what accidental equipment failure looks like, and I know what a place charge looks like, and that was a place charge." He held her eyes. "I need to tell someone who isn't going to make my information disappear." "You should tell the investigators." "There are no investigators here yet. There's a man named Felt who came in on the civilian helicopter, separate from your military landing, and he walked straight past the medical intake, and he's been on his phone since he got inside." She was very still. "You came in with Felt?" "On the same transport. He didn't come to help with the injured." Kowalski's jaw tightened. "He came to see who made it out, and specifically what they might have with them." "What do you have with them?" He looked at her for a moment, the calculation of trust running behind his eyes. She waited. "There's a drive," he said. "The documentation Colonel Briggs mentioned to his people during the evac. I heard it on the radio. The copies the whistleblowers made before the secondary event. One of them gave me a copy before the detonation because I was the person she trusted to get out." He paused. "I need to know it gets to the right place before Felt figures out I have it." "Where is it?" He tilted his head slightly toward the left side of his body, the injured side, the side where his burns had been dressed and his arm was immobilized. "In the dressing, against my ribs." She absorbed this. A flash drive in a wound dressing in a trauma bay in the middle of a mass casualty event. This was a specific variety of situation that she had not expected to encounter again and had hoped was behind her. "Don't tell me more about the contents," she said. "I don't need to know the contents. I need to know if Felt knows you have it." "He suspects someone does, doesn't know it's me. He'll figure it out." She looked at his chart, made a clinical notation, routine, professional. "I'm going to update your dressing in about 30 minutes. For clinical purposes." He understood. "Okay." She left the bay and found Harlan in the corridor, which was where she'd expected to find him, because Harlan, in her experience, was always in the corridor, the liminal space where he could see everything and commit to nothing. "Kowalski," she said quietly. "Bay 12. He has the documentation." Harlan's expression shifted by approximately 2 degrees, which was significant. "Is he stable?" "Stable enough." "But Felt, I know." Harlan's phone was in his hand. "Felt made a call 40 minutes ago. I have someone tracking who received it. If it was internal, if he has contacts who can enter this building under a federal authority, then we have maybe an hour before this department becomes a different kind of problem." "Less," Harlan said. "These things move fast when people are motivated." She looked at the department around them, at the patients and the staff, and the managed chaos of a system under maximum stress. At Diane Pratt, who was at the far end of the corridor coordinating bed assignments with a phone at each ear, and the expression of someone who had decided to hold the whole floor together through sheer professional will. At Dr. Tate, who had come out of the fragment procedure looking like a man who'd been somewhere that changed something in him and was still processing what. "I need to update Pharaoh," Nora said. "Yes. And I need you to tell me everything about the Prohibition Clause before Felt tries to use it as leverage inside this building." Harlan started talking, low and fast, and she listened with the full attention of someone memorizing terrain. "Okay. The update to Wendy Pharaoh happened in her office, which was a room the size of a large closet, with a desk and 2 chairs and a window that looked at another window. Pharaoh listened to everything Nora said without interrupting, which took effort, She could see the effort, and when Nora finished, she sat with it for a moment. "The man in Bay 12 has federal evidence in his wound dressing," Farrow said. "That's one way to describe it." "That is the only way to describe it." Farrow pressed her palms flat on the desk. "And the man named Felt, who has no clinical authority in this hospital, is potentially trying to access that evidence before investigators who have legitimate jurisdiction can receive it." "Yes." "And you are—" Farrow stopped, started again. "You are not who your employment paperwork says you are. My nursing license is genuine. My clinical qualifications are genuine. My name is functionally genuine." A pause. "The rest is complicated." "Commander Elena Voss," Farrow said. Nora didn't react to the name anymore. She'd run out of the energy to react to it. What matters right now is the department and the patients and making sure Felt doesn't compromise either. "What do you need from me?" "You're the medical director of this emergency department during an active mass casualty event. Your authority over clinical personnel and clinical areas is absolute during this incident under state emergency management statute. If Felt or anyone without hospital credentials tries to access clinical areas or patient information, you have the authority to restrict that." Farrow was already nodding. "I know my authority. Use it." "I intend to." She looked at Nora with the direct assessment of someone who had spent the last several hours recalibrating her understanding of a person. "For what it's worth, what you've done today, the fragment case, the tamponade, the department prep, those things—" "Don't," Nora said, not unkindly. "Not yet. Let's get through the next hour." Farrow nodded, picked up her phone. Nora went back to the department. "What?" She was checking Rourke's vitals. Stable, incrementally improving, which was the right direction, when she heard the change. Not a sound exactly. A shift in the ambient quality of the department, the way noise reorganized itself when something entered a space that altered its dynamics. She came out of Bay 9 and saw them. 3 men, civilian suits, moving through the ambulance bay entrance with the coordinated efficiency of people who had practiced moving through spaces that resisted them. 2 of them were scanning the department. The third was on a phone, reading something off the screen. Behind them, at the entrance, a Dunmore police officer was standing with the posture of someone who had been asked to provide escort and was already uncomfortable with what the escort was for. Felt was with them. He had the satisfied posture of a man whose call had been answered. He found her across the department, and she watched his posture confirm that she was the objective. And she understood in the 3 seconds before this became something she had to actively manage that the next phase had arrived ahead of schedule. One of the suited men was holding a document, the kind of document that had federal letterhead and was designed to end arguments rather than start them. And from the other direction, coming fast down the corridor from the direction of the surgical suites, was Russell Tate. He had seen the men from somewhere above. His face was the face of someone who had processed a situation from a distance and arrived at a conclusion and was moving toward it with the intention of inserting himself between it and something he had apparently decided to protect. He reached her before the suited men did, which surprised her because she had not expected him to move toward this. "I don't know who those people are," he said, low and fast, "but I know what that kind of document looks like, and I know it doesn't belong in my department." "It's not your department," she said. "Today it is." He held her eyes. There was something in them she hadn't seen before, not the comfortable dismissal of before, not the processing of the fragment procedure, but something that had moved past both of those into the specific expression of someone who had decided to take a position. "What do you need?" She looked at the suited men, looked at Felt, who was pointing toward her, looked at the document. "I need 30 minutes, she said, "and I need you to be very, very difficult about access to the clinical areas." Tate straightened. His posture changed in the way that she'd seen him carry himself in the fragment procedure, when the work had pulled out something underneath the comfortable confidence, the actual version of himself, working. "I can do difficult," he said. The suited men were 12 feet away, and from the direction of Bay 12, 2 of Harlan's tactical personnel were moving toward the corridor with the contained purpose of a unit that had received a directive. And from the nursing station, Patty Oswald was standing with her arms crossed and her phone in her hand, having apparently decided that whatever was happening at the end of the corridor fell under the category of things she was going to be present for. The suited man with the document stopped in front of Nora. He was perhaps 45, and he had the flat, careful diction of someone trained in federal administrative procedure. "Elena Voss," he said. "I'm Special Agent Douglas Mara, Federal Bureau of Investigation. I have a federal authorization order." "She's in the middle of active patient care," Tate said, stepping half a step forward with the calm authority of a man in his own building. "Dr. Tate, Chief of Trauma Surgery, and this is my department, which is currently operating under mass casualty emergency protocols, which means the care of my patients takes precedence over any administrative paperwork you have on that document until the event status is resolved." He paused. "You're welcome to speak to our hospital legal counsel, who I'm going to call right now, for documentation purposes." Mara looked at him with the recognition of someone encountering an obstacle that was more substantial than expected. And in the 2 seconds that this created, Harlan's personnel reached Bay 12. Felt saw it. His eyes moved to the bay door, and something shifted in his face. The calculation of a man watching a variable resolve against his interests. He moved toward the bay with a purpose that cut through the ambient movement of the department. "Stop him," Harlan said, from somewhere to Nora's left, to his personnel, with the precision of a command in the field. One of the tactical personnel stepped into Felt's path. Felt looked at him, looked at Harlan. His face moved through something that was beyond calculation now and into something rawer. The exposed expression of a man who had built his position on the assumption that certain information would never reach anyone with the authority to act on it, and who was watching that assumption come apart in real time. "You have nothing," Felt said. To Harlan. To the room. The emphasis was wrong. Too much of it, which meant the opposite of what he intended. "Bay 12, Harlan said to Nora quietly. "Now." She moved. Behind her, she heard Tate continuing to talk to Mara in the patient, implacable tone of a man who had decided to be genuinely difficult, and she heard the sound of a second FBI agent's voice joining the first, and she heard Patty Oswald saying something to someone in the flat, declarative tone that Patty used when she had decided something was final. She pushed through the door of Bay 12. Kowalski was sitting up. His face was the face of someone who had been listening to the sounds outside and had understood their meaning. In his uninjured left hand, he was holding a small flash drive. He had retrieved it himself, which meant he'd reached into his own wound dressing, which was not comfortable, and he had done it anyway. "Take it," he said. She crossed to him in 3 steps, took the drive. It was small, unremarkable, the kind of thing you could put anywhere. She put it in the only place she had that Felt could not access without a warrant that would take longer to obtain than the time they had. Not on her person, not in the equipment, but in the documentation system, flagged as a clinical attachment on Kowalski's chart, submitted through the hospital's secure internal server with a notation that made it part of the official medical record. Digital. Time-stamped. Legally protected as part of a patient's medical documentation under HIPAA statutes that were considerably harder to override than a federal authorization order for a specific individual. She submitted it at 14:37:22. She stood up straight and looked at Kowalski, who was watching her with the specific expression of a man who had just understood what she'd done and was in the process of deciding if it was brilliant or insane. "That'll hold him?" he asked. "Long enough," she said. "Maybe." The door of Bay 12 opened. It was not Harlan. It was not Tate. It was not Mara or his agent or Patty Oswald or any of the people she'd been tracking. It was a man in a hospital gurney being pushed fast by 2 of Harlan's personnel, and the man on the gurney was older, late 60s, she assessed immediately, with the injuries of someone who had been close to the initial Harwick detonation and had survived it through the unlikely combination of body armor and physical positioning. He was conscious. His color was terrible. His vitals, reported by the personnel pushing the gurney in the shorthand of field communication, were dropping. And she knew his face. Not personally. She had never met him. But she knew the face the way you knew any face that appeared regularly in classified briefings for 3 years. The face that signed certain orders, that appeared at the top of certain organizational charts, that had specifically signed the authorization for Unit 17's classified operations at Harwick. General Warren Stahl, the commanding authority over everything that had happened in that facility for the past 6 years. He looked up at her from the gurney with eyes that were focused and intent, despite everything his body was doing, and he said, with the deliberate emphasis of a man choosing his words through serious pain, "Commander Voss." Not a greeting, a recognition. And underneath the recognition, something else, an urgency that was not about his own survival. "You have to hear what I have to say," he said, "before Felt reaches this room, before anyone stops me." His hand came up, gripped her wrist with a strength that was not matched by his color or his vitals. "There's more on that drive, Voss. There is more on that drive than you know, and some of it is about you." The door behind her opened for the second time. Felt stood in the doorway, and behind Felt, visible over his shoulder, was Mehra. And Mehra's expression had changed. He was no longer the flat professional of the authorization order. He was reading something on his phone with an expression that meant his instructions had just changed, which meant someone above him had just received information that altered the operational picture, which meant the drive she had filed into the hospital's medical record system 6 minutes ago had already begun to move through channels she hadn't built, but was very glad existed. General Stahl's grip on her wrist tightened. "Listen to me," he said. "The name on that drive, the one who arranged the secondary device, it isn't who Felt wants you to believe it is." Felt stepped into the room. Felt took 3 steps into the room and stopped. Not because anyone physically stopped him, because the room had a quality that resisted forward movement. Too many people, too many variables, too much that was already in motion that he hadn't accounted for. He read it the way people like him read rooms, and for the first time since he'd walked into Crestfield Memorial, he arrived at a calculation that didn't resolve cleanly in his favor. Nora didn't look at him. She kept her eyes on Stahl, who was still gripping her wrist with the determined strength of a man spending resources he didn't have because he'd decided this specific expenditure was worth it. "General," she said quietly, "you need to stop talking and let me assess you." "Not yet." His grip didn't ease. Felt told the Oversight Committee that Unit 17's safety documentation was falsified by internal personnel, that the failures were manufactured to destabilize the program from inside, that the people who died in the secondary event were the ones responsible for the falsification. He paused to breathe, and the pause was difficult. "None of that is true. The drive has the originals, timestamps, access logs, authentication chains. They were not falsified. The program failed on its own merits, and people inside knew it and covered it." "General?" "The name at the top of the cover authorization," he said, and his eyes moved to Felt without moving off her completely, holding both of them at once, "is not mine and it is not Harlan's. It is his." The room processed this. Mehra, still in the doorway behind Felt, had stopped reading his phone. He was listening now with the full attention of someone whose professional landscape had just shifted. Felt's face did something she had not seen it do before. A tightening, almost invisible, the expression of a man who had maintained a controlled surface for so long that the surface cracking registered as almost nothing, which somehow made it more significant than visible panic would have been. "The general is critically injured and not competent to—" "He's speaking clearly, and his GCS is 15, Nora said. She said it without heat, just as a clinical fact, which made it harder to argue than anything adversarial would have been. She finally looked at Felt directly. "If you have a medical basis for disputing his competency, I need to hear it. Otherwise, what he's saying is a legally cognizable statement made by a conscious adult." "This is not a legal proceeding." "No," Mehra said from the doorway. He said it with the quiet authority of someone who had been standing in the background recalibrating and had finished. "It's not. But what I'm reading right now is." He held up his phone, displaying something she couldn't read from this distance, but whose significance was legible in the way he was holding it. "I've just received a directive from my field supervisor. The authorization I came in here with has been suspended pending a review triggered by a medical records filing at this facility." He looked at Nora. 1437, your timestamp. Felt turned to look at Mehra. "Agent Mehra, Director Felt, I'm going to need you to stay in this room." Mehra stepped fully through the doorway, and his second agent came in behind him, and the quality of their presence changed in a way that was unmistakable. They were no longer escorting. My supervisor is on the line with your oversight committee right now. Until I have a clearer picture of what that conversation produces, no one in this room is going anywhere. Nora felt Stahl's grip on her wrist loosen slightly. Not release, just shift. And she took it as permission to turn her full attention to his clinical state, which she should have been doing for the past 5 minutes and had not been able to because the room had needed managing first. His blood pressure was worse than the personnel had reported. His abdomen had a rigidity on the left side that suggested splenic involvement, and the bruising pattern across his left flank, even partially visible under the hospital gown, told her he'd absorbed more from the primary blast than his field assessment had captured. He was bleeding internally, slowly, but bleeding. I need to move him to a surgical bay, she said to everyone and no one. He can't go anywhere until... Felt started. He can and he will, because this is a hospital and he is a patient, and that, she said with the precision of someone who had been waiting to say it, is actually the only thing that matters in this building. She looked at Harlan's personnel. Get a transport team. Bay 7. Tell Tate I need him again and I need him ready. One of them moved. She looked at Kowalski, who was watching from his bed with the careful eyes of someone who had discharged his primary responsibility and was now observing the aftermath. You okay? She said. Better than I was an hour ago, he said. Is it going to hold? What you filed? Long enough, she said, which was the same answer she'd given before, and she still meant it the same way. Not a guarantee, but a calculated bet on the sturdiness of hospital record systems and federal evidence protocols. The timestamps authenticated as medical documentation the moment it entered the system. Pulling it requires a separate legal process, and that process will take longer than whatever Felt had planned to do in the next 30 minutes. Kowalski nodded. He looked at Stahl, who was being moved carefully onto a transport gurney by 2 of Harlan's personnel. He looked at Felt, who was standing in the center of the room with the expression of a man who had stopped calculating because the numbers were no longer cooperating. He really didn't think you'd be here, Kowalski said. Nobody thinks I'm going to be anywhere, Nora said. It's been useful. Russell Tate met her outside Bay 7 with the particular look of a man who had been interrupted mid-something and had decided the interruption was acceptable. He'd been doing post-op checks on the fragment patient. He was still in his surgical cap. Stahl? He said, reading the name from the intake tag as the gurney passed him. Possible splenic laceration, maybe hepatic involvement. Left flank bruising suggests significant impact from the primary event. He was partially shielded, but not enough. She walked beside the gurney, monitoring Stahl's face, his breathing rate. His pressure is dropping, and his abdomen is guarding. We need imaging. We need imaging, and we probably need the OR. Do we have a window? Tate was already doing the calculation she'd seen him do in the fragment bay. The version of him that set the comfortable authority aside and just worked the problem. Kellerman finished a splenography 20 minutes ago, or 2 should be coming available. He looked at her. You want to be in the room. It was not exactly a question. I can assist, she said, if you want me there. He was quiet for a step and a half. After this morning, I want you there. She absorbed that without ceremony and kept walking. The imaging took 11 minutes. The CT told the story she'd suspected. Grade 3 splenic laceration, active blush indicating arterial involvement, small amount of free fluid in the abdomen that was going to become a larger amount of free fluid if they waited for it to develop an opinion about its direction. Tate looked at the images with the focused absorption of a good surgeon reading terrain, and Nora stood beside him and did not offer opinion until he asked. He asked, splenography or splenectomy? Splenography if the arterial blush is in the upper pole and the hilum is intact. Splenectomy if you open and find the parenchyma isn't holding. Don't commit to either until you have direct visualization. He looked at her sideways. You're not supposed to know this. I know, she said. Are we doing this? They did it. Elsewhere in the hospital, things were happening that Nora was not present for, but would be told about afterward in pieces by different people with different vantages, which meant she assembled the picture the way you assembled anything that happened while you were in an operating room. From the outside, from the residue, from what the people who'd been watching described with varying levels of accuracy and emphasis. What happened was this. Mara's supervisor, a senior FBI field director named Walsh, no relation to the ER physician, had gotten on a call with the Federal Oversight Committee that governed programs like Harwick 37 minutes after Nora submitted the drive to the medical record system. The contents of the drive, flagged by the time-stamped submission into a federal adjacent documentation system, triggered a mandatory hold on all related administrative actions pending verification. This was not a dramatic intervention. It was a procedural one, the kind that happened when someone with enough information put that information in a place governed by rules that larger authority had to respect. It was, in other words, exactly the kind of thing Felt had been trying to prevent for several months, and had not succeeded at preventing because he had not accounted for a trauma nurse who knew how hospital record systems worked. The review of the drive's contents began within the hour. The authentication chains Stahl had described were there. Timestamps, access logs, version histories that showed the original safety documentation had not been altered by internal program personnel, but had been suppressed by a director-level decision that routed around the standard oversight chain. The directive that authorized the suppression had a digital signature. The signature belonged to Garrison Felt. Mara had Felt in a controlled conversation in one of Crestfield's administrative conference rooms by the time Tate was 3 inches into Stahl's abdomen. The conversation was not an arrest, not yet, that required a specific process, but it was the kind of conversation from which exits became complicated, and Felt, who understood federal procedure the way most people understood the floor plan of their own house, understood exactly what the conversation meant. He asked for his attorney at the 40-minute mark. The request was granted. Attorneys were called. The conversation continued, as these conversations did, at the pace of institutional machinery rather than human urgency. Harlan was informed of the Felt situation by Mara's second agent, who found him in the corridor outside Bay 9 checking on Rourke. Harlan listened, asked 2 questions, received 2 answers, and then stood for a moment doing the internal recalculation of a man who had been running contingencies for several hours and was now arriving at a version of events that was better than his median projection. He did not allow himself to show this, because Harlan did not show things in corridors, but the agent later noted that he looked briefly like a man who had put something down after carrying it a long distance. Diane Pratt found out about Nora's actual identity through a combination of the name that had been called across the department and a conversation with Patty Oswald, who had been assembling the picture piece by piece with the systematic patience that 22 years of watching a floor had given her. Diane sat with this information in the break room with a cold cup of coffee for approximately 4 minutes, and then she went back to managing the floor because the floor still needed managing, and that was what she knew how to do. What she thought about during those 4 minutes was not something she shared with anyone immediately. But Patty, who knew her well enough to read the set of her shoulders, said later that Diane had come back to the floor looking like a woman who had just had a very specific kind of reckoning with herself, and who was going to have to decide what she did with that. The splenography took 2 hours and 14 minutes. Tate did the work. Nora assisted with the focused precision of someone who had been in more surgical theaters than she would ever list on a resume, providing instrument positioning, anticipating steps, flagging twice, once when the retraction angle was creating a visibility problem, and once when she saw a bleeding point at the lower pole that Tate's attention hadn't reached yet. Both times Tate adjusted without comment, integrated the information, continued. They worked without friction. Not because they'd become allies, that would have been too fast and too simple, but because the OR had its own grammar, and they both spoke it. The blush was in the upper pole, the hilum held, and Tate performed the repair with the careful craft of a surgeon, working at the edge of his most demanding cases rather than comfortably inside his routine. It wasn't easy for him. She could see the effort in his shoulders, the deliberate pace. But he did it. When it was done and Stahl was being transferred to the ICU under the care of the intensivist, Tate stripped his gloves and stood at the scrub sink with the water running and did not immediately say anything. Nora stood at the adjacent sink. "Where did you learn to do that?" he said finally. "The fragment procedure this morning, the tamponade, the way you read the Stahl imaging." She considered what to give him. A long time in places where improvisation was the only option. That's not an answer. I know. She turned off the water. But it's all I have right now. He looked at her. He had the expression of a man who had spent the last 14 hours revising an assessment and was somewhere in the middle of the revision. The Ostrowski thing, he said. The motorcycle crash patient. Gary, from weeks ago, with the splenic laceration she'd caught before discharge. I handled that badly. Yes, she said. No buffer, no softening, but she said it without heat. I'm trying to... Dr. Tate. She looked at him directly. You stayed in the fragment procedure when another surgeon might have handed off. You came to Bay 9 this morning without knowing what you were walking into. Today I'm less concerned about Ostrowski than I am about what happens in this hospital after today. She paused. The instinct was there. You just had layers on top of it. He was quiet for a moment. Is that a generous read? It's an honest one. He nodded slowly, in the way of someone accepting something they hadn't asked for but could use. General Stahl was stable in the ICU by 5:15 in the afternoon. His first coherent, extended conversation, on record, with Agent Walsh and a second FBI representative present, lasted 40 minutes. Nora was not in the room for it. She was on the trauma floor, finishing the patient management of the mass casualty event's final cases. Because the event was winding down the way these things did, not dramatically, but incrementally, patients stabilized and moved and monitored, the emergency status de-escalating to high-volume managed rather than active crisis. She was updating documentation at the nurse's station when Harlan found her. He sat down in the chair beside her without asking if it was a good time, which was fine because it wasn't a good time and he knew that and was going to talk to her anyway. Stahl's statement corroborates the drive contents, he said. Felt authorized the suppression of the safety documentation 18 months ago, when the program's internal review board began moving toward an external report. He authorized the secondary event at the facility to prevent the documentation from reaching federal investigators. Nora continued updating her documentation. He killed people to protect program failures. 2 dead confirmed, multiple injured, the people on those helicopters. His voice was even and had weight under the evenness. Rourke, Kowalski, the ones you kept alive today. She stopped typing, looked at the screen for a moment. The prohibition clause, she said. The one he was going to use to remove me from the clinical area. Doesn't apply. The legal review is 20 minutes. The clause prohibits unauthorized intervention in classified program operations. Treating injured people in a civilian hospital during an emergency event is not program operations by any coherent reading. He paused. It was never going to hold. He was counting on the threat of it being enough to move you before anyone looked at it closely. He didn't know me well enough. No. A pause. Very few people do. She resumed typing. Harlan sat with her in the particular silence of 2 people who had worked in proximity to each other in difficult conditions and had learned that silence between them did not require filling. Your status, he said after a while. What about it? The separation terms. They're going to be reviewed in the context of today. What you did here is going to be in the record. He chose his next words with the care of someone who had decided honesty was worth the discomfort. There are people who are going to want to talk to you about coming back. I know. What do you want me to tell them? She finished the documentation entry, looked at the screen. Tell them I'll think about it. She closed the chart. After I finish my shift, Harlan looked at her sideways with something that might have been, on another face, amusement. You have 9 patients still active. 8. Kowalski just got moved to the ward. He stood. Rourke is asking about you. I'll check on him before I leave. He moved to go, and she said, without looking up from the next chart, Harlan. He stopped. The drive. The authentication chains. Was any of it about why I left the program? A pause that contained the answer before he spoke it. Some of it. She absorbed this. Felt's file on my separation. Yes. And the separation itself, the official reason. Another pause. Was not what you were told. She held very still for a moment. Not visibly. Someone walking past would have seen a nurse at a documentation station doing her job. But inside the stillness was something that moved, something that had been locked in a specific position for 4 years and had just felt the mechanism shift. "Okay," she said. "Voss?" I said, "Okay, Harlan." Not dismissal, just the sound of someone deciding to put something in a place where it would wait rather than a place where it would run. He left. 13. Diane Pratt found her at 6:40. The department had come down from mass casualty status at 6:15, transitioning to standard high volume, and the shift change was in process. The incoming nurses receiving handoff, the outgoing staff compressing the adrenaline and sustained effort of the last 7 hours into the specific exhaustion that only came from that combination. Diane came to the documentation station where Nora was finishing the last of her patient notes and stood there without speaking until Nora looked up. Diane's face was the face of someone who had been having a long internal argument and had arrived at a position and was now committed to it. "You should have told me," Diane said. "I couldn't." "That's not the same as saying I was wrong." "No," Nora said. "It's not." Diane looked at her with the complicated expression of a person who had two distinct things to address and was trying to find an order for them. "What you did today, the patients you managed, the response coordination, the surgical assist work, none of that is within the scope of what I was given on your credentials." "No." "But all of it was—" Diane stopped. Started again. The language of institutional hierarchy didn't fit what she was trying to say, and she was enough of a professional to know when to set it aside. "You're better than I gave you credit for. Better than I was willing to see. And I made your time here harder than it needed to be because of it." Nora looked at her. Diane Pratt was not a small person, and this was not a small thing for her to say, and they both knew it. "The Ostrowski note," Nora said, "the documentation I put in his chart when you told me not to go around Tate. I remember. You weren't wrong about the chain of communication. You were wrong about what mattered more in that specific moment. Those are different corrections." Diane received this with a small, precise nod. "You're telling me I was doing my job badly rather than maliciously." "I'm telling you both things were probably true," Nora said, "and I understand the difference between them." Another silence. This one had a different quality. Not comfortable, not resolved, but honest. Which was better? "What happens now?" Diane said. "With you. With your position here." Nora looked at the patient board. 8 names. All of them known to her now. Not just as files, but as the specific people she'd spent the day keeping alive. Rourke, who'd said her name from a tamponating heart. Kowalski, who'd pressed a flash drive into her hand. The others from Harwick and Gary Ostrowski and Donald Ferris weeks ago with his pleural effusion and Hugh Daly with his elevator door laceration and all the small and unremarkable moments of this 6-week disguise that had not been entirely a disguise. "I don't know yet," she said, and then, because it was true, and she had no good reason to withhold it, "I'd like to stay." Diane looked at her with the expression of a woman recalibrating a category. Then, with the pragmatic acknowledgement of someone who managed a trauma floor and understood what resources were worth, "Your license is valid." "Yes?" "And your shift ends at 7. Technically ended an hour ago." Diane looked at the patient board, looked at Nora. "Finish your notes," she said, which was not a welcome back and was not an apology, and was also somehow both of those things, compressed into the specific language of a floor that had work to do. Nora turned back to her documentation. But she checked on Rourke at 6:58. He was in a monitored bed in the step-down unit, pressure stable, saturation good, with the look of a man who had been very close to something and was in the early hours of understanding the distance he'd cleared. He watched her come in and do the quick visual assessment that nurses did when they entered a room before anything else. "You're the reason I'm here," he said. "You'd have gotten here anyway." "Maybe." He didn't argue it beyond that, which she appreciated. "They told me who you are. Who you were." "Both are true at the same time," she said. "How's your pain?" "Manageable." He watched her check the monitor readings. "Voss." "Callum." "Here you're Callum," he said. "Okay, Callum." A pause. "Thank you." She looked at him. He was 34 and he'd been close enough to a secondary detonation to have his heart fill with blood and stop working correctly. And he was lying in a hospital bed in Dunmore, Maine in the specific aftermath of surviving something. And he was thanking her with the directness of someone for whom the words weren't a formality. "You're welcome," she said, and meant it without embellishment. She finished the assessment and was making her notation when his roommate, a small, shared, step-down room, efficient use of space, said something from the other bed. She hadn't registered him initially, had been focused on Rourke, but now she looked. The man was elderly, perhaps 70, and had nothing to do with Harwick or helicopters or federal evidence chains. He'd been admitted 2 days ago for a post-operative complication that was resolving. He had a television remote in his hand and a bag of crackers on his side table, and he'd been watching the news on low volume, and he looked at Nora with the interested assessment of someone who had been observing the afternoon's events from the particular vantage of a hospital bed. "You the nurse they were talking about?" he said. She looked at him. "I don't know what they were saying." "The military boys, the suits." He gestured at the hallway. "All afternoon people coming through, heard your name a few times." He paused. "Different names, actually." "That happens," she said. He chewed a cracker, looked at Rourke, looked at her. "What you did today," he said, "the whole floor knows. You know that, right? These nurses talk." She was quiet for a moment. "They do," she agreed. "You should let them," he said, in the tone of someone who had arrived at a conclusion from long enough away that it was simple. "Whatever you did before, wherever you came from, you're here now." He pointed at the floor with his cracker. "This is where it counts." She looked at him for a moment. He was absolutely sincere and slightly crumb-covered, and had no idea what she'd been doing for the past 7 hours beyond the general impression of competence and noise. And he was right anyway, in the way that simple things were sometimes right despite the complexity surrounding them. She finished her notation, told Rourke she'd check on him in the morning if she was on shift, and walked out of the step-down unit and down the corridor toward the locker room. Her phone buzzed. The same unknown number as the morning. A single line. Drive authenticated. Federal Review opened. Felt suspended pending investigation. She read it, kept walking. A second message arrived before she reached the locker room door. "There's more on the drive, Voss. About your separation. About who made the call and why. You need to see it before the review goes to closed session." She stopped in the corridor. The locker room door was 12 feet in front of her. The trauma floor was behind her. The hospital around her was in the particular post-crisis state of sustained operation. The sounds of a building that had been through something and was continuing anyway. She read the message twice. Deleted it. Stood in the corridor for a moment with the phone in her hand. 4 years ago, she had been told she left Unit 17 voluntarily, separation by mutual agreement, circumstances not further specified in the official record. She had accepted this because the alternative, challenging it, had required resources and allies she didn't have in the particular place she'd been when the separation happened. The authentication chains on the drive. Felt's access logs. 18 months of suppressed documentation. And now someone was telling her that her own departure from the program, the event that had produced 6 weeks in a supply closet in Dunmore, Maine, and 4 years before that in a series of places she'd chosen for their distance, was also in there. Also covered. Also altered. She put the phone in her pocket and pushed through the locker room door, and the noise of the hospital fell away behind her, and she stood in the small institutional quiet of a room that smelled like industrial soap and old lockers, and the specific weariness of people who worked with their hands in high-stakes conditions. She sat on the bench in front of her locker, still in her scrubs, still with the residue of the day on her hands and in her hair, and in the particular specific places in her body that carried the weight of sustained operating at maximum. She thought about the drive, about Stahl's grip on her wrist and what he'd said before Felt came through the door, about Harlan's careful pause when she'd asked him about her separation, about the fact that she had been told a specific story about herself for 4 years and had lived inside it, and that story was apparently not the whole story. And the part she was missing was sitting in an authenticated federal evidence file that was currently in the middle of a review process. She was still sitting there when the locker room door opened and Patty Oswald came in, pulling off her badge lanyard, making the small noises of end-of-shift transition. She stopped when she saw Nora. "You're still here," Patty said. "Apparently." Patty sat down on the bench across from her with the unhurried ease of someone who had learned when to push and when to just occupy the same space. She opened her locker, took out her bag, did not look at Nora with the pointed expectation of a response. After a minute, Nora said, "Do you ever find out something about your own history that requires you to rebuild a fairly significant portion of what you thought was true?" Patty considered this with appropriate seriousness. "Once," she said, "when I was 42, it was about my mother." She paused. "Took me about 3 years to stop being angry about it." "How did you get through the 3 years?" Patty closed her locker, looked at her. "Showed up to work," she said. "Helped people. Did the thing that was in front of me." Nora absorbed that. It was, as advice went, both completely obvious and genuinely difficult, which was the quality of the most honest advice. She had been doing exactly that for 6 weeks, maybe longer, depending on where you started counting, and she supposed she would continue to do it, and whatever was on that drive would still be on that drive when she was ready to look at it. "Patty," she said. "Yeah. I'm sorry I couldn't tell you more. From the beginning." Patty waved this off with the particular gesture of a woman who had calibrated her expectations of colleagues to something realistic. "You told me what you could. You did the work." She picked up her bag. "The rest is—" She shrugged. "None of my business, probably." She left. The locker room was quiet again. Nora changed out of her scrubs with the methodical focus of someone completing a task that required no thought, which was fine because her thoughts were elsewhere. She was nearly done when her phone buzzed a third time. Not the unknown number. A hospital extension. Internal system. She answered. It was the ICU charge nurse, a man named Tobias, who spoke with the measured calm of someone who had learned to deliver information at the speed of comprehension. "Ms. Callum, I'm sorry to reach you post-shift. General Stahl asked to speak with you. He says it's time-sensitive. Something about the review going to closed session within the hour." She held the phone, looked at her locker door. "Tell him I'm coming," she said, and put her street clothes back on the bench and picked up her scrubs. She put her scrubs back on in 40 seconds and went up to the ICU. The unit at this hour was in its evening rhythm, quieter than the day's crisis, but not quiet. Monitors, soft footsteps, the particular ambient hum of a place that did not sleep. Stahl was in the second room on the left, with an FBI agent seated outside his door and an IV running into his left arm, and the look of a man who was in pain and had decided to set it aside for the duration of the conversation. He watched her come in and pull the chair to the bedside without ceremony. She sat. She looked at him. "You said it was time-sensitive," she said. "The review goes to closed session in 40 minutes, he said. Once it closes, the specific evidentiary record becomes restricted. What's in there about your separation? You won't be able to access it through standard channels for months, maybe longer." "Tell me," he breathed, assembled it. 4 years ago, Unit 17 produced a field assessment recommending discontinuation of the Harwick program's primary research track. The assessment was based on safety data from 3 operational cycles. The officer who authored that assessment was you. She was still. "I know I wrote the assessment." "You don't know what happened to it." He met her eyes. Felt received it, altered the conclusion section, and submitted the altered version to the Oversight Committee under your name. The altered version recommended continuation with minor protocol adjustments. The committee voted to continue the program based on what they believed was your professional recommendation. He paused. When the program's failures became undeniable 18 months later, Felt needed a record that distributed responsibility. He used the altered assessment as evidence that the program's continuation had been recommended by the field specialist, you, and that any subsequent failures were the result of inadequate field evaluation. The air in the room had a specific quality. She sat in it. "He used my name," she said. "He used your name and your rank and your record. When you raised concerns internally about the program's direction in the following months, he initiated the separation process. The official file says mutual agreement. The actual process was—" Stahl stopped. His jaw tightened. "He manufactured conduct concerns. Minor things, individually, collectively enough to justify transition out of the unit. And you were gone before anyone with the authority to look at the full picture had reason to look at it. She thought about the 4 years. The Vermont clinic, the drive to Dunmore before her shift to sit with bad coffee and watch the bay, the supply closet, Diane Pratt's office, and the particular specific exhaustion of making herself smaller than she was for reasons she had accepted without full information. She had believed she left because the program had decided she wasn't useful enough to keep. She had spent 4 years carrying that. It's in the authentication chain, Stahl said. The original assessment, your actual words, your actual conclusion, is in the archived system with a timestamp that predates the version felt submitted. The alteration is documented. The conduct file is documented. He paused. The review committee is going to see all of it, but I wanted you to hear it from me directly before it becomes a bureaucratic process, because you deserve to know 4 years ago and you didn't get that. She looked at her hands. There was a version of this moment where something broke open. Tears or rage or the dramatic release of a burden held too long. She did not have that version. What she had instead was something quieter and in some ways harder, the specific experience of understanding that a thing you had built your identity around was not what it appeared, and that the rebuilding would take time and would not be cinematic, and that knowing the truth did not automatically heal the shape the wrong story had carved into you. But it was a beginning. Beginning had its own weight, and she respected it. The Oversight Committee, she said, when they see the assessment, the original one. Your original conclusion was discontinuation, Stahl said. If it had been accepted and acted on, the program would have ended 3 years before the events at Harwick today. He let that land without elaboration, because it didn't need elaboration. The people on those helicopters don't, she said. That's not useful right now. He accepted this. No, he agreed. It's not. She stood, looked at his chart, a reflex, the automatic assessment of the nurse who was always doing that regardless of what else was happening. Pressure better, color improved. The surgery had bought him what it needed to buy. Thank you, she said, for telling me. I should have told you 4 years ago, he said. I knew the separation felt wrong. I didn't push hard enough on the file. No, she said, you didn't. She said it without cruelty, but she also said it without the absolution he might have been hoping for, because she was not in the business of providing absolution for things that had cost her 4 years of her life, and he was adult enough to understand the difference between being thanked and being forgiven. She left the ICU and stood in the corridor outside it for a moment, in the fluorescent quiet of a hospital evening, and then she walked back downstairs. Garrison Felt was arrested at 9:17 that night, not in the hospital. The FBI had moved the administrative conversation to the Dunmore field office by early evening, and the arrest happened there, which meant that the staff of Crestfield Memorial did not witness it directly. What they witnessed was its aftermath. The 2 agents who came back through the emergency department shortly after 9 to speak with Wendy Farrow, and the particular quality of Farrow's expression when she came back from that conversation, and the way that quality moved through the staff who saw her face and asked what had happened. It moved fast. Hospitals always moved information fast, and this information had the velocity of something people had been waiting for without knowing they were waiting for it. Patty Oswald heard it from the unit coordinator. Gary, the ultrasound tech, heard it from Patty. Marco, the resident, heard it from Gary and went quiet for a moment in a way that meant he was processing something that connected dots he'd been watching all day without the key piece. The ICU charge nurse Tobias heard it from the nursing supervisor and relayed it to the step-down unit, where it reached Rourke and Kowalski within 20 minutes. What the arrest meant clinically for the people on those floors was less than what it meant symbolically. And the symbolic weight of it was substantial in ways that were hard to articulate. The thing that Felt had constructed, the version of events where the program's failures were distributed to the people who documented them, where the secondary event at Harwick was a tragedy rather than a decision, that version was formally over. It did not erase the dead or fully repair what had been broken, but it was over, and that mattered. And the people who had survived Harwick knew it mattered in the specific way that survivors knew things. Nora heard about the arrest from Harlan, who found her in the vending machine alcove off the main corridor at 9:32, eating crackers she hadn't tasted yet because she'd forgotten to eat since 6 in the morning and her body was filing an insistent complaint. He sat down across from her. He did not say anything for a moment. "Stahl told me," she said. "I know. He called me after you left." "Were you going to tell me about the assessment, the separation?" "Yes." He said it without flinching. "I was building toward it. I was looking for the right moment." "There wasn't a right moment," she said. "There was just this one." He absorbed that. "Fair." She ate another cracker. "Felt altered the assessment to keep the program running and then used it to remove me when I became inconvenient." "Yes." "And for 4 years the official record said I left voluntarily." "Yes." She looked at the vending machine, at the reflection in the glass, herself, in scrubs, eating crackers in a hospital corridor at 9:30 in the evening, 6 weeks into a life she had built out of the wreckage of a story she now knew was not entirely her own. "What happens to the official record now?" she said. "The Oversight Committee's review will produce a corrected record. Your original assessment, your actual recommendations, your actual separation circumstances, all of it becomes part of the formal documented history." He paused. "You're cleared, fully. What Felt did is on record as what it was." She sat with this. Cleared was not the same as whole. Cleared was the beginning of the paperwork, not the end of the caring. But it was something real. "The program," she said. "Harwick. Is it done?" "The research track you recommended discontinuing 4 years ago is done. The facilities will be reviewed. Personnel records are being audited." He held her eyes. "There are people who want to talk to you about what comes next. Not the program. That's finished. But the oversight structure, the review process. People who think the last 4 years demonstrated the cost of not having someone in certain rooms who would actually say what they saw. Someone like me. Someone exactly like you." She finished the crackers, folded the wrapper, looked at it for a moment. "I'll talk to them," she said. "After some sleep and after I check on my patients in the morning." He nodded. He stood to go and she said, "Harlan?" He stopped. She looked at him. "Thank you for coming. I know it wasn't just for me, but the timing was for you," he said simply. "The rest was the situation." He left. She sat alone in the vending machine alcove for another 4 minutes, which was what she needed, and then she went back to work. The next 2 weeks moved the way Aftermath always moved. Not cleanly, not in straight lines, but with the accumulating momentum of things resolving at different speeds. The Federal Review produced its formal findings on day 11. The Harwick program's primary research track was officially terminated. The safety documentation authored by the internal whistleblowers was certified as authentic. The altered field assessment was identified in the record as a fraudulent submission, and the original document, Nora's actual words, her actual professional conclusion, was entered into the corrected record with her name restored to it. Garrison Felt was formally charged on day 8. The charges were substantial: obstruction of federal oversight, destruction of evidence, conspiracy in connection with the secondary event at the facility. The last charge carried the most weight and the most complexity and would take time to fully prosecute, as these things did. But the charges existed and were on record, and the people who had built their careers on the assumption that Felt's version of events was durable now had to contend with the specific institutional exposure of having been associated with it. The 2 whistleblowers who had died in the secondary event were formally identified as program personnel who had been attempting to route safety documentation to external federal investigators. Their names were entered into the record as the thing they had actually been: people who saw something wrong and tried to stop it and paid for that with their lives. This did not give them back to anyone who had known them. But it was the truth, and the truth was what they had been trying to achieve, and it existed now. Crestfield Memorial's trauma department returned to its regular rhythms with the particular resilience that hospitals had, because hospitals did not stop, because people kept needing them, regardless of what the institution had just been through. The mass casualty event became part of the department's history, discussed in the break room and the handoff notes and the quiet conversations between people who had been there and had gotten through it and were still processing what getting through it meant. Dr. Russell Tate was not a transformed person. He did not emerge from the events of that day as a categorically better physician in every respect, because people did not work that way, and it would have been a disservice to him and to reality to suggest it. What he was, more accurately, was a doctor who had encountered the specific experience of being shown his own ceiling and having helped something happen above it, and who was now in the uncomfortable but productive position of knowing that experience was available to him if he chose to seek it rather than avoid it. He ordered more consults. He listened differently in cases where his initial assessment felt settled. He did not always do this, and sometimes he reverted, but the reverted version was no longer entirely comfortable to him, which was a start. Diane Pratt's reckoning was private and took longer. She was not the kind of person who processed things in public or arrived at conclusions dramatically. What changed was visible only in pattern over time. The way she distributed assignments shifted incrementally, the way she responded to flagged concerns from nurses she'd previously dismissed, the specific things she did when a new hire caught something a senior physician had missed, which was to stand in the corridor and say, very quietly, "Good. Document it. Tell me next time and I'll back you up." She said this the first time approximately 3 weeks after the mass casualty event to a night shift nurse named Amara, who had caught a medication error, and she said it like someone who had been building to it and was relieved to have finally said it out loud. She did not apologize to Nora directly. Nora did not expect her to. What Diane gave her instead was something more durable. She gave her the floor, the actual floor, the work, the patience, the respect of being treated as someone whose presence was an asset rather than a threat. It was imperfect and sometimes awkward, and the hierarchy between them was still there because the hierarchy was part of how the floor ran, but the hierarchy no longer had contempt in it, which was enough. Rourke was discharged on day 5. He came to find Nora on the trauma floor before he left, walking under his own power, though carefully, and he held out his hand and she shook it, and he said, "I'm going to be back at work in 6 weeks," which was optimistic by clinical standards, but she understood it as a statement of intention rather than a timeline. And she said, "Take the 8 weeks." And he said 6. And she said 7. And he thought about it and said, "Deal." Kowalski left on day 7. He stopped at the nursing station on his way out, in civilian clothes, looking more like a person and less like a patient. And he said to Nora, "Whatever you did with that drive, it worked." And she said, "You did the important part." And he said, "We both know that's not entirely true." And she said, "Go home, Kowalski." And he laughed, which was the best sound she'd heard in the entirety of those 2 weeks. On the 15th day, she drove to the waterfront before her shift. Same spot. Same bad coffee from the same gas station 2 blocks from the parking area. The fog was thinner than it had been 6 weeks ago. Late November, moving toward December. The quality of light changing, the bay doing what bays did in the cold months. She sat with the coffee and looked at the water and thought about what Patty had said. Showed up to work. Helped people. Did the thing that was in front of me. It was not, she understood now, a philosophy of smallness. It was not the resignation of someone who had stopped trying to matter. It was something harder than that. The specific kind of discipline that chose what was real and present over what was abstract and distant, that committed to the patient in front of you rather than the meaning of your life as a general concept. She had been doing it for 6 weeks without knowing she was doing it, and she had been doing it for years before that in a different context, and the through line of it was the truest thing about her. She was not a hero in the way that stories like to frame it, singular, certain, without doubt. She had doubted herself constantly. She had spent 4 years eating the weight of a story that wasn't true and hadn't found a way through it entirely, had just found a way to keep working alongside it. She had been petty enough to notice when her catches were credited to others and careful enough to say nothing. She had made choices in that department that had consequences she hadn't fully mapped, and some of those consequences had been for her and some had been for others, and she was still sorting through which was which. But the people who had come in on 8 helicopters were alive, most of them because she had been in that building. And Gary Ostrowski was home with 2 cracked ribs and a resolved splenic laceration instead of dead in his apartment. and Donald Ferris had his pleural effusion drained and was probably complaining about the television reception somewhere. And the documentation that 2 people had died trying to protect was in a federal record now, authenticated, indelible. Not everything she'd done had worked. She'd had to be guided through nothing. She'd been the one guiding. But that was its own kind of isolation, its own particular loneliness, the experience of operating at a level that had no one beside it. She had been the most capable person in several rooms today, and that was not an uncomplicated thing to be. It meant carrying more. It meant the mistakes landed heavier. It meant the moments where she hadn't been fast enough, hadn't caught it in time, hadn't reached the room before the patient deteriorated. Those moments belonged entirely to her, and she would carry them the way she had learned to carry that category of thing, not away from herself, but somewhere she could acknowledge and not be paralyzed by. Her phone buzzed. A hospital number. Internal. She let it ring twice, which was the amount of time it took her to finish the thought she was finishing, and then she answered. Callum? It was Pharaoh. You're not on shift for 40 minutes. I know. I have a consult request from the Federal Oversight Review Committee. They want a voluntary statement from you about the Harwick program's operational safety, the field assessment, your original conclusions, what you observed during those cycles. A pause. It's voluntary. I wanted you to hear it from me first. She looked at the water. When do they want it? They're flexible. This week, if possible. I'll do it, she said. Schedule it whenever. Also, Pharaoh paused with the careful timing of someone managing several things and had something additional to add. Administration has asked about formalizing your position, given everything. There's a conversation to be had about scope of practice documentation, credential verification, official role. Another pause. I told them to wait until you were ready to have it. I'm ready, Nora said. Good. She could hear Pharaoh deciding something on the other end. For what it's worth, Callum, what you did in this department. I've been doing emergency medicine for 18 years. What you did here, I've seen maybe twice. Nora was quiet for a moment. The water moved. I had good people working beside me, she said. That's most of it. It's not most of it. No, she admitted. But it's a significant portion. She heard Pharaoh almost laugh, which was not a sound she'd heard from her before. See you in 40 minutes. The call ended. She held the phone and looked at the bay and thought about the cold and the fog and the specific quality of the morning. Not beautiful in any dramatic way, just real, present. A particular Tuesday in December in a small city on the coast of Maine. She had spent 4 years disappearing. Not because she was a coward and not because she gave up, but because the information she'd been given about herself had said, you don't belong in the rooms that matter. And she had believed it long enough to construct a life around the belief, and the life had been small and controlled and had the specific character of someone managing damage rather than doing work. What she knew now, and had always known underneath it, in the hands that didn't shake and the eyes that found the bleed before the imaging did, was that the information had been wrong. Someone had deliberately given her wrong information about herself because she had been the person most likely to stop what they were doing, the highest form of compliment, framed as elimination. She was still here. That was the thing about the quiet ones, the overlooked ones, the people filed in the category of not quite enough by people who needed to believe that category was real. They were still here. They showed up in mismatched socks and absorbed the insults and counted the blood products and documented the concerns and caught the bleeds that the imaging missed. They did the work regardless of whether the work was credited to them or the recognition came or the room understood what they were seeing. And sometimes, not always, not tidily, not without cost, the truth came out. Not because the world was just, but because the truth was durable in ways that institutional cover-ups consistently underestimated. Because the people who saw what was real kept seeing it. Because documentation existed and time-stamped itself, and authentication chains didn't lie. Because occasionally 8 helicopters landed in a hospital parking lot, and everything that had been hidden had to become visible. She finished her coffee, crushed the cup, got out of the car. She walked into Crestfield Memorial Hospital through the main entrance, which she didn't usually use. She used the staff entrance, the quiet one, the one that didn't require moving through the lobby. Today she walked through the lobby, past the information desk and the chairs and the morning visitors with their coats and their coffee and their particular expressions of people moving through a hard thing, and she pushed through the door to the clinical wing and went up to her floor. Patty was already at the nursing station. She looked up when Nora came in, and she looked at her the way she'd been looking at her since day 8. Not differently exactly, just with the recognition of someone who had always suspected the full picture and was no longer looking at a partial version. "You're early," Patty said. "Couldn't sit still," Nora said. Patty handed her the morning report without further comment, because that was what the morning required, and Patty understood mornings, and Nora took it and stood at the station and read through the night's events and the patients who needed her and began, as she always had, as she would continue to do, in this hospital or the next or wherever the work took her, to make herself useful. Not invisible, not small, not the version of herself built from someone else's calculations about what she was worth. Just present, just working, just the most capable person in several rooms, no longer pretending otherwise, finally letting that be exactly enough.